Hello, and thank you for joining us as we discuss cervical cancer awareness and prevention. This is a joint endeavor by Emily Barton, Kayla Martin, and Alan Arnold. We are current nursing students at Virginia Highlands Community College and have chosen to provide information on cervical cancer. This information will include risk factors that may lead to this cancer, signs and symptoms of cervical cancer, how and when individuals should be screened, and the difficulties that lie therein. And finally, we will discuss treatment options for this type of cancer. Almost all cases of cervical cancer are caused from long-lasting infections with certain types of human papillomavirus. Pap tests or HPV tests can find changes in the cervix before they turn into cervical cancer. HPV vaccine is given in a 2 or 3 shot series to both male and females between ages 9 and 26 years old. The earlier the vaccine is given, the more effective it will be against HPV infection. Here are a few of the risk factors for cervical cancer. Having sex with many partners or with a partner who has had many sexual partners themselves. Early sexual activity, such as having sex before age 16, can increase your chances of getting infections such as HPV. If you have a weakened immune system. Smoking. People in their late teens to mid-30s are the most at risk. Since cervical cancer does not usually cause pain or other symptoms at first, early detection is the best form of prevention. As it spreads, however, there are some changes you may notice. Abnormal vaginal bleeding after sex, vaginal bleeding after menopause, vaginal bleeding between menstrual periods, longer and heavier menstrual periods, vaginal pain during sex, pelvic pain, or increase in discharge or mucus from the vagina. The most common method for screening for cervical cancer is a Pap test. The Pap test can also identify infections caused by yeast, bacteria, and viruses. Women in their late teen to mid-30s have an increased risk of getting cervical cancer. However, the Pap test does not screen for ovarian, uterine, vagina, or vulvar cancers. Here we can look at the difference between a Pap test and an HPV test. During a Pap test, cells are gently scraped from the outside of the woman's cervix and vagina by a healthcare professional. A healthcare professional then identifies any precancerous or cancerous cells. For the HPV test, cells are collected from the Pap test and tested specifically for HPV. Women ages 21 through 29 should get a Pap test every 3 years. However, it's recommended women aged 30 to 65 should get co-testing, which is a Pap test plus HPV testing every 5 years. There are a few barriers to cervical cancer screenings. Here are a few. Age, lack of awareness, lack of transportation, fatalistic health beliefs, low health literacy, and low quality healthcare services. If cervical cancer is found, there are 3 treatment options: chemotherapy, radiation, or surgery. Chemotherapy is usually in the form of a pill or shot that is given for a set number of days or weeks. The 2 different types of radiation are external and internal. And the third option is surgery, where a surgeon will cut cancer cells off the cervix, remove the cancer cells with a laser, freeze the cancer cells with cryotherapy, remove the cancer cells with cone biopsy, or an hysterectomy. Here are a couple links to the CDC website where you can find out more information about cervical cancer. Now, let's take a short true-false quiz to see how much we've learned. True or false? Most cervical cancers are caused by long-lasting infections with certain types of HPV. That's true. Number 2. True or false? Pap tests or HPV tests cannot find changes in the cervix before they become cervical cancer. That's false. They can find changes in the cervix. Number 3, true or false? Longer and heavier menstrual periods may be a possible sign of cervical cancer. That is true. Number 4, true or false? The two screening tests that are used to look for early signs of cervical cancer are a Pap test and HPV test. That is true. Number 5, the primary reason women adhere to timely cancer screening is because of encouragement from family and friends. That is false. The primary reason is usually due to encouragement from a local healthcare professional. Number 6, treatment for cervical cancer may involve surgery, radiation, chemotherapy, or a combination of the three. That is true. Number 7, stopping smoking is one way to help prevent cervical cancer. That is also true. Number 8, elderly women are most at risk for cervical cancer. That is false. Teens to women in their early 30s are most at risk for cervical cancer. Number 9, women aged 21 to 29 should receive a Pap test every 5 years. That is false. It's recommended women aged 21 to 29 receive a Pap test every 3 years. Number 10, radiation treatment for cervical cancer could involve internal or external radiation. That is true. I hope with this video we were able to raise some awareness for cervical cancer. If there are any questions, please replay the video to view the provided links for more information on the topic. Thank you again for watching.